So bowel cancer is really common. It's the second commonest cause of cancer death in the UK, and therefore anything that we can do to prevent its occurrence is really important. There are certain aspects that can be affected and certain that can't. In terms of the primary prevention of bowel cancer, this refers to things that we can do in our lifestyle that affect our risk of developing cancer over time. So that will include things such as diet, and we'll discuss that in another section in a short while, and other lifestyle factors, activity, so being more physically active, avoiding smoking, avoiding excess alcohol. So there are certain things that you can do to prevent your risk or minimize your risk. And again, there are certain things such as the genetic factors of bowel cancer, which again we'll discuss in more detail, which unfortunately you can't alter significantly at the moment. In terms of the diet or foods that increase the risk of bowel cancer, it's well recognized that having a diet that contains a lot of red meat is an increased risk factor. Things that are processed in your diet, so processed meats or processed carbohydrates, are generally bad and increase the risk. Things that contain additional salt, and then alcohol is also a risk factor for colorectal cancer, as it is for other cancers and other diseases. A diet that's low in dietary fibre can also increase your risk of bowel cancer. And then there are separate factors that are not diet related, but that relate to increased risk. So smoking, as per other cancers, and obesity is recognised as a risk as well. So in terms of the best diet that can prevent bowel cancer, in theory, the best diet would be a meat-free vegetarian diet. But let's face it, we all like some meat. I like nothing more than on a Friday night having a small steak. So I think that's not necessarily a reasonable proposition for most people, but minimizing the amount of red meat that you have and substituting in other protein sources for that. So that would include things like eating more poultry, eating more fish as opposed to red meat, avoiding processed foods. So essentially things that are more natural in their origin. Plant sources of protein are also good, and unsaturated fats, because it's recognized that saturated fats are a risk factor. So those things in moderation are probably a good advice. Taking it too far to the extreme, whilst minimizing your risk of bowel cancer, might also minimize your enjoyment of your diet. In terms of whether bowel cancer is preventable, there is an element to that is true, but unfortunately at this current time, it is not 100% preventable. It's recognised that, as well as the risk factors that we've talked about in terms of lifestyle modification and things like that, there are genetic factors that contribute to bowel cancer development. And whilst we are gaining increasing understanding about those genetic elements on a day-by-day basis, which means that potentially in the future, genetic modification or at least stratification of risk will become more a possibility. At the moment, that isn't the case. So to answer the question in a single word, is it preventable? No. The other factor that I think needs to be recognised, that as with all cancers, bowel cancer increases in incidence as we get older. And we are, as a population, getting older because we have other medical interventions that mean that we're not dying of cardiac disease or other illnesses that in the past have killed us at an earlier age. So inevitably, at some stage, something is going to catch up with us. And for a lot of us, that is going to be cancer, because as we get older, our cells in our body have had longer to undergo genetic mutations. And that is essentially what leads on to cancer. In theory, however, with bowel cancer, it is potentially preventable in that we know that most bowel cancers start off as precancerous polyps within the bowel. And there is the option or opportunity to remove those polyps before they become cancer. And that is a large part of what screening programs rely on, picking up things that are precancerous. and increasingly will become better at detecting patients who are at risk of developing those polyps, which will become cancers if left long enough in the bowel, and therefore removing them. So there is conceivably a time in the future when bowel cancer will become preventable, but at the moment that isn't the case. So in terms of preventing bowel cancer naturally, other than the things that we've talked about, so avoiding the predisposing factors through diet, through physical activity, through avoiding alcohol, there are increasing amounts of evidence that there are other things that increase your risk. One of the very topical things at the moment that people are looking into is the role of the microbiome, which is essentially the bacteria that are in your gut, the natural bacteria. And we recognize that some of those have a key role in preventing inflammation, and others predisposed to inflammation in the bowel, and that in turn leads on to an increased risk of cancer. So certainly there might be natural things that can be done to improve that. Some probiotic yogurts contain healthy bacteria, as they're sort of referred to. And other things potentially leading on in the future will allow us to influence that more. But our understanding of that is still at a relatively early stage. In terms of the prevention of colon cancer and rectal cancer, the two are hand in hand. I would advise patients and people in general to try to stick to the healthy lifestyle that we've talked about, the dietary factors and everything else like that. But there are some other key things that really can help people. And so the two things that I would probably like to dwell on would be, firstly, the importance of participating in national screening programs. In the UK, we have a screening program that looks at people who are of a certain age, so it's currently run from the age of 60, and looks at people who might have some blood in their feces. And if they have on a screening test, then they're called for a colonoscopy, a camera test. And that allows us, firstly, to detect colorectal cancers at a potentially earlier and more treatable stage, but also to pick up patients who will have precancerous polyps in the bowel that can be removed at colonoscopy and prevent them from becoming bowel cancers. So that would be my first piece of advice. And then secondly, at the end of the day, despite everything that we've talked about, you are going to be really limited in terms of the option of preventing it completely. And so if you do develop symptoms that might relate to bowel cancer, and these are very difficult because they reflect a lot of other conditions as well, such as irritable bowel or hemorrhoids, and these are very common conditions. But if you notice a change in your bowels, if you notice rectal bleeding, or anything that you're worried about, weight loss, abdominal pain, that's persistent, then you should get checked out. And again, catching these things earlier, one of the great things about colorectal cancer, and one of the reasons I became a colorectal surgeon, is that if it's caught at an early stage, the outcomes and survival can be excellent, and certainly better than a lot of other cancers. So please don't just ignore your symptoms, get them checked out.